In this skill, what we'll be showing you is eye irrigation and bandaging. If you suspected C-spine injury, you obviously would have had your partner or someone else hold C-spine immobilization. In this instance, we're going to assume that this is a medical patient that has got a splash into their eyeballs of some type of materials that we're going to need to irrigate out and eventually bandage the eye. As usual, you're going to take standard precautions. Gloves will be the minimum that you'll take. If you have a calm, cooperative patient before you begin irrigation, you might consider having the patient tilt their head back. In this case, he's sitting up. And I would ask him to hold this in place so that any irrigated fluid would actually flow from the medial to the lateral aspect, from the inside of the canthus of the eye to the outside. After he's done that, you'll need to retrieve about 1 liter of normal saline in a bottle from your ambulance. You'll need to also have the bandaging materials you might need later. Irrigation needs to occur for at least 20 minutes, longer if necessary. After that time, you'll either arrive at the hospital or, in some cases, you may have to actually bandage the eye yourself. At the end of it, you'll remember to bandage the uninjured eye to prevent any kind of sympathetic eye movement. First thing we're going to need to do to irrigate this eyeball is we're going to need to take our liter and we'll actually have the patient tilt your head further back. And remember, you'll pour this slowly from the inside of the eye towards the outside of the eye. And again, it's going to take about 20 minutes. You may actually use more than this 1 liter that is there. Once you finish that, then you're actually going to have to bandage the patient's eye itself in addition to his uninjured eye. First thing you'll need to do is take a 4x4 gauze, which I've already pre-made here, simply by taking your EMT shears, fold it in half, and cut either a V or a moon shape, unfold it, and this will give you some padding around that eye. In that case, then we can ring the patient's globe. If your patient's calm and cooperative, they can hold that in place. And you'll need to take a cup. The cup needs to be of a type that's not going to collapse. Styrofoam's not a good choice. You can use cardboard and plastic as long as there are no deformities to the plastic that might cut the patient. When you apply it, to put it over, you'll need to put something inside of it first, but it'll fit like so. Initially, you want to take a 4x4 piece of gauze, open it completely up in this manner, put it inside the cup, and then pour some of your saline that's remaining inside the cup. Remember to empty it out. We've now got saline moistened gauze inside the cup. And then just as I showed you before, you'll need to place that over the eyeball itself. We won't have a hole in the end of this unless there's an impaled object from some type of trauma. But in this case, remember, we're treating a medical patient that has a splash in their eye. Once that's on, your patient can hold that, or a bystander or someone else could hold it in place for you, as long as they're careful. And what we'll need to do is, just like a head bandage, we'll need to get started by putting what looks like a head bandage on with some curler gauze, and we'll lock this in place. And once we've done that, we actually need to go around the cup. At some point, you'll have to get another piece of gauze. I won't do it yet, but we'll have to tape or tie this in place to prevent any type of sympathetic eye movement. The whole time I'm doing this, I have to be very careful not to lift the cup up. And it may take you maybe 1, maybe 2 pieces of gauze to get this done. I'm now at the point where I would like to turn a piece of gauze kind of sideways in a diamond shape to hold this in place. And I'm careful to check the patient's ears so that he actually can hear while I'm talking. And I'll finish using the first piece. With that done, I'll take a second roller gauze, and with the second roller gauze, we'll pick up where we left off. In this case, I'll need to lock it again in place. Being careful not to move the cup. Can you breathe okay?
Yes, sir.
Try not to cover over the patient's nose, and periodically come back and check and make sure that the patient's ears are not covered up. Once you come to the end of it, you can tape it or tie it, or the easiest thing to do is simply to tuck it in place. And at that point, then you're ready to transport your patient, or you're already en route to the hospital. You want to be very careful not to leave your patient alone at this time, because now you've bandaged both eyes, and he basically, for all intents and purposes, has no other ability to see, so you're responsible for that.